lovely. Make yourself comfortable there. My name's Dr. Sarah, pleased to meet you. What can I do for you today? Okay. Alright. So you've got some pain in your ears. Okay. How long have you had it for? Okay. Any other signs of illness? Okay, that's fine. Alright, have you been in any water anywhere? Or have you been scratching your ears at all? Right, okay. But you do get a wax problem. Are your ears hurting all the time, or is it just now and again? Alrighty. I'll pop some gloves on and take a little look at you. Are you okay with latex, or would you prefer non-latex gloves? Okay. Have you been taking any painkillers at all? Right, okay. Alrighty, okay. I'll just give your ears a little wipe round first, okay? Right. It's got a nice little moist cloth here, alright, okay. Just tell me if anything's uncomfortable. That's all right. Good. Okay. You right there? Perfect. So I'm going to have a little press around the outer ear to start off with, all right? Yeah, okay, you just tell me if anything's uncomfortable, won't you? Okay? Okay, so just pressing from the top of the ear down and around. Okay, just going to have a little pull on the lobe area there. Is that a little bit sore? Okay. Behind the ear looks okay. Okay, I'll check this side. Again, just tell me if anything is uncomfortable. So your left ear was more uncomfortable than your right. Okay, have you got more pain in general in the left side? Okay. Alrighty. So, just going to have a look down your ear with this otoscope. Okay. Have you seen one of these before? Right, okay. Just has a light and enables me to look down the ear canal. Okay? Perfect. I need you to keep very, very still for me while I do this. If it's uncomfortable, just keep still, but pop up your hand and I'll stop, okay? Alright. I don't want to cause you any more pain than you're already experiencing. Okay? Right. Okay, my lovely. Going in with the otoscope now. Just pulling up and back a little bit. Here we go. Okay. Okay, so you do have quite a large wax build up here. Okay. I can't really see too much. It looks quite soft towards the outer ear, but it may be a bit more impacted lower down. Okay. Alright. I'm going to take that out of there now because I can't see too much because there is that large wax build up. Just bear with me, take that out. There we go. You're alright there, not dizzy or anything. Perfect. Let's take a little look at this side. Just pulling up and back and popping this in now. Okay. There we go. Yeah, there is more wax down here. Doesn't look quite as bad as the other side, but I think this is where your discomfort is coming from, my lovely. I can't see any signs of infection at the moment, so that's good. Just withdraw that now. There we go, well done. Okay. So what I'm going to do at first is I'm just going to try and remove some of the more liquid wax from near the edge of the outer ear, alright? And then I'll pop some drops down to dissolve anything that's hard behind it, alright? Okay. Just going to use these special applicators, okay? Now, I hope you don't put cotton buds down your ears, okay? You do? Okay, well, stop doing that. On the edge here and just inside is fine, but don't go popping the Q-tips down your ears, okay, because it pushes the wax further down, which is probably what you've been doing, isn't it? Yeah. But these are special applicators which are just used for just inside the ear canal, okay? Alright. So let's see what we can do with this side first, because this side, let's get some paper there, was the worst. So here we go. Keep nice and still for me. Again, pop your hand if you're uncomfortable, okay? So that's removed some of the more liquid wax. Okay, just get another applicator. Okay, and we'll do this on your right side. Okay, perfect. Okay, here we go, my lovely. Nice and still for me, thank you. Okay, so now I'm going to pop some special drops down your ears. They won't sting or burn, they will fizz and crackle for a little while, okay? And they will break down the harder wax that's further down the ear canal. It's probably putting some pressure on your eardrum a little bit, particularly in this left side. Okay, so we need to remove that. Just get these mixed a little. Yes, they are similar to what you can buy in a pharmacy, but these are a little bit stronger, okay? Right, I'll pop some down your left ear first, okay? Here we go then, my lovely. Here's one. And two. There, how does that feel? Good, good. One. And two. You doing all right there? Okay, perfect. So what I'm going to do is use this spoon-shaped tool here and just gently scrape out the wax, okay? Yeah. Again, keep still for me and pop up your hand if anything is uncomfortable. I'm hoping it comes away quite easily though. Yeah. Okay? Perfect. Alright. So let's start with this side again and see what we can remove. Okay. Alright, here we go, my lovely, nice and still. feels better already. There's a lot come out. Yeah, okay. Okay, let's have a look down here. Nice and still again, thank you. Everything out of there. Okay. Are you feeling all right, my lovely? I'll just give you a second while I just update those notes there. Right, so I'm going to have another look down your ears with the otoscope now, okay? I'm also going to be popping a little puff of air down the ears just to see how your eardrum reacts, okay, to the air pressure. It won't hurt, no, it just might tickle a little bit, okay? Right, okay. Let's just get the otoscope set up there. Perfect. There we go. Right. Keep still for me, and I promise you this won't hurt. Alright. So I'm just going to pop the otoscope in there. Okay. And a couple of little air puffs coming now, my lovely. Okay. Here we go. One more time. Okay. And everything looks fine down there now. Normal eardrum. It reacts normally. There's a normal light reflex. I can see the structures behind, and the ear canal actually doesn't look as irritated as I thought it might do. Okay. So I'm happy with that. Let me just take that out. Okay. Was that alright for you? You liked it? Good. I told you it wouldn't hurt. So let's look at this side. Just popping the otoscope in now, my lovely. Okay. And some little puffs of air for you. Just check that again. Yeah, that's fine. So the wax is cleared from here. Just a little bit left, which we need. We will need a little bit of earwax. It's not going to completely eradicate it from the ear canal. Okay. But everything's looking healthy down here as well. Okay, So are you experiencing any pain at the moment? Okay, that's good. It feels better. Excellent, alright. What I'm going to do is put some soothing drops down your ears. I'll just help cool it down a little bit after we've been doing quite a bit of work in there. Yeah? If you start feeling more pain or anything unusual, do give me a call, alright? Or if it's out of hours, pop yourself to A&E. But I don't think you'll have any problems. There's certainly not any signs of infection that I can see. Alright? Okay, so let's find these drops. There they are. Okay. So these won't fizz, but they'll just feel super cooling. Because I want you to be as comfortable as possible. Have you got any plans for the rest of the day? Okay, it's very busy outside today. There's been so much traffic and roadworks around here recently. Don't know what's going on. In fact, the whole town is upside down. Yeah. I think it's going to be sunny though today, so maybe you can have a relax in the sun. Okay, right. Let's just pop a couple of these in. Okay, here's one. And two. Perfect. A little wipe around there. A little massage in. Okay. Right. Good. Okay, and there's one, and two. Okay, little massage. Okay then, my lovely, you okay? Nice and refreshed? Good. Well, you're free to go now. Okay? Yeah. Just keep an eye on your ears, but I'm sure they'll be fine and there's no sign of infection there. Alright. It may be that you have a build-up naturally that happens quicker than other people. Alright? Yeah. If you think they're starting to build up again, please come back. Okay? Don't put any Q-tips down there. If you're starting to get any pain, hearing loss or discomfort or any dizziness, just come back and we'll take another look, and if needs be we can do another cleaning for you. Alright, my lovely? Okay. Okay, you take care and enjoy the rest of your day. Okay. Bye-bye. Oh, hello there, my lovely. Make yourself comfortable. My name's Dr. Sarah. Could you just confirm your name for me? Okay. That's perfect. Just going to check the notes I have here from when you called in earlier. Okay. So I believe you've been experiencing some ear pressure and pain, some discomfort around the ears. Yeah? Okay. Alright, and how long has this been going on for? Okay, about a week, okay. Okay. Do you have a history of problems with your ears? Okay. Wax buildup, okay. Okay, do you have any other symptoms? Nasal congestion, fevers, sore throat? Just a bit of headache. Okay, a little bit dizzy. Alright, okay. Okay. Right. So has this been affecting your ability to work or function? A couple of days. The recent days, yeah. Okay. Well, given that you've got a history of problems with your ears and wax build-up, obviously I need to check you out, and if there's anything there that I can remove, I'll remove it for you today. Alright? Okay, do you have a latex allergy at all? No. Okay, that's fine. Right. Let's get some gloves. These are latex gloves, that's why I asked you about the allergy. We do have alternatives. Right, that's those on. First thing I'll do is just check your lymph nodes around your neck, my lovely. Just keep nice and still for me. Just going to have a little press around. Okay, just behind your head. Okay, anything tender there? Okay, I can't feel anything unusual, so that's good. Okay, I'll just feel across your collarbone area. Okay, that's fine. Right, I'll gently wipe around the ears before I take a close look at them. Okay. Right. Got some lovely wipes here, nice and cool and refreshing. Alright. Keep nice and still for me. I'll just have a gentle wipe on your left ear. You like that? Good. Another wipe. Okay. Let's take a look at your right ear now. Okay, so I'm going to have a press around on the outer ear. Okay, tell me if anything's uncomfortable at any point. Alright? Okay, I'll just be sort of feeling around and having little pinchy movements and just gently tugging on the ear. Okay, that can just indicate how much pain you're getting or if it's a sign of infection. Okay, but also be looking very closely for any signs of unusual skin details, lumps, bumps, anything like that. Alright? Here we go with your left ear now, my lovely. feel anything unusual there? How did that feel? Just a little bit sore. Okay. Okay, how was that? Okay, a tiny bit uncomfortable again. Okay, right, let me just make a little note of that. Alright. Okay. I'll just quickly take your temperature before I look down your ear, okay? I'm just going to pop in the thermometer. Just hear some beeps, okay? You'll be pleased to know that your temperature is perfectly normal, so that's good news. Okay, it's at 36.9, so that's really good. Okay, so what I'm going to do now, my lovely, is I'm going to use this otoscope here and just going to pop it down each ear and have a little look at what's going on, alright? I need you to keep very, very still for me, but please pop up your hand if anything is too uncomfortable for you, alright? Okay, just turn that on. Right, there we go. And it's got a little light on it, and you can see the light. It helps me see right down your ear. Okay, perfect. So, I'll be very gentle, don't worry. Here we go, going in now. There we go. Just moving that around. You have got a lot of impacted wax down here, so I am going to remove that. Okay, a little bit of redness in the ear canal, but I can't see beyond that right now, so I'll just remove that. Okay. How was that? Alright, okay. And again on this side, just pulling up and back and popping that in there now, mother. Lots of wax yet again, and some slight redness. to remove that wax. Just pull that out now. Well done. Okay, just going to make a note. So we've got wax, action, both ears, slight erythema in both auditory canals. Okay. Right. So what I'm going to do is put some really lovely drops down your ears. They're my patients' favourite drops. They all love them. And they fizz and crackle a little bit, but they work through the wax and break it down, so it's a lot softer and easy to remove, okay? Right. Have you had these kind of drops before? Yes, they're very similar to the ones that you could get at the pharmacy, but these are a little bit stronger, okay? Give them a nice shake. Just make sure they're nicely mixed. You'll just need a couple of drops in each ear, but they won't sting or burn. Right. I often get asked that, is this going to hurt? But no, these won't. Okay, I'll start with your right ear. Okay, so here's one. And two. You can hear the sound? Good. That means it's breaking through all of that wax for me. So here's one. And two. Should be crackling on both sides now. Good, perfect. Alright, let me just make a note of what I've administered there. Okay. How are you doing? Good, good. Okay, so what I'm going to use is a little extraction tool. I'm just finding one that I think will be better suited to what I'm seeing down there. Okay. So I'm going to use this little spoon-shaped tool to just scoop out the wax that I can. I've also got two types of brushes here. I've got a soft brush and more of a metallic type of brush, and they both work in slightly different ways just to remove any excess wax after I've had a little go with the scoop. Is that alright? Again, if anything's uncomfortable, please just pop up your hand, but do keep still, because I don't want to injure your ear in any way. Alright? Okay, so we'll start with your left ear. I'll just have a little scrape around, make sure I've got something to put the wax on there. That's perfect. Okay. Right, here we go. Nice and still for me. Just going to go in with the softer brush at first. Okay. Right. Here we go. Going in with a different type of brush. Okay, this might feel and sound a little bit different. Okay, my lovely. Just going to take a little look down there now. Okay, just with the otoscope again, very quickly. Okay, just popping that in now. Okay. That is looking so much better. And your eardrum looks fine, but you had a very, very nasty impaction down there, but we've successfully removed it, which is perfect. I'm happy with that. Just remove that now. Okay. So I'm just going to move over to your right ear now and do the same. Are you okay? You're not dizzy or anything? Perfect. Remember, pop up your hand if you're uncomfortable. Okay. Right. Just put my things down there. Right, so I'm going to start with the scraping again now, okay? There we go. Big chunk just came out then. Okay. Let's have a look. Have a go with the brush now. That seems to have removed a lot there. So I'm just going to go in with the soft brush, just for that. With that different brush, just to finish this job off properly. I like to do a thorough job, of course. Look down with the otoscope now. Nearly done, my lovely. You've done fantastically well. Okay, here we go, just popping this in. of redness in the ear canal will soon calm down now that wax is gone. There's no infection. And the eardrum looks perfectly healthy, as do the structures behind. Both ears are perfectly fine. And we'll need to just keep an eye on your wax build-ups though. Okay, I'll draw that now. There we go. Alright. How are you feeling? Good, good. Let me just make a little note of what I've done there. Alright, just have a little relax. I'm going to put you some very nice cooling drops down your ears in a moment. Okay. Do you pay for your prescriptions? Okay. So just pop to the pharmacy and get some olive oil eardrops, alright? Use those daily, they will help soften any wax that's in there, alright? You don't need to start using them just yet. Leave it a little while, leave it a couple of weeks, and then just use a little bit of that, okay? I'll ask you to come back in about 4 weeks' time and we'll check your ears again to make sure that they're not getting blocked up too quickly or that the olive oil is working well. Alright, you do seem to produce a lot of wax naturally, which some people do, but obviously if it impacts regularly you run the risk of getting more pain and infection in the end, okay? So just ask at the pharmacy, they'll know what you need if you just say olive oil eardrops. Okay, right then, so talking of eardrops, got some nice soothing ones as promised. Okay, just put a couple in each ear before you go. You're not dizzy or anything? Perfect. Okay. Right. There we go. So here's one. And two. There we go. They're lovely, aren't they? And here's one. And two. Perfect. Okay then, my lovely. If you're feeling well and happy, then you're free to go. Okay, don't forget to get your olive oil eardrops and make an appointment for 4 weeks' time with the receptionist, and we'll just keep a check on you because I think we just need to do that. Alright, okay. Well, enjoy the rest of your day now. Okay, take care.